You've probably heard someone say, "He's in the ICU," and everyone gets quiet. The room changes, eyebrows drop, people even start whispering, like the ICU is Hogwarts and no one wants to say Voldemort's name. But today, we're pulling back the curtain. What really happens inside the ICU? Why do people go there? Why are there so many machines that beep more than a microwave? Let's unpack it in a nutshell. ICU stands for Intensive Care Unit. Not, I can't understand, even though it might feel that way when you walk in. The ICU is a special department in a hospital where critically ill patients are monitored and treated 24/7. Think of it as the VIP lounge of the hospital, except instead of champagne and sushi, there are ventilators and 4 drips. People here need serious medical attention. Their life systems, breathing, heart, kidneys, brain might be failing or under serious threat. So the ICU brings in all the big guns. Machines, specialists, and nurses who don't blink. Not every cough, sneeze, or stubbed toe gets you into the ICU. You have to really impress death to get admitted. Common ICU cases include severe infections like sepsis. That's when your body goes full WWE on itself. Organ failure, heart, lungs, kidneys, you name it. Traumatic injuries, car accidents, gunshot wounds, falls. Surgical complications, sometimes after major surgery. Patients go to ICU just to be monitored. Stroke or heart attack, your brain or heart just got a slap from life. Respiratory distress, when breathing becomes a full-time struggle. So no, ICU isn't where they send you because you wanted extra attention. It's where they send you because your body hit the panic button. The ICU staff is like the Avengers of medicine. Everyone is highly trained and ready to jump in. Intensivists, these are doctors specialized in critical care. They manage everything from your lungs to your liver. ICU nurses. These nurses are superheroes in scrubs. They know your blood pressure before you do. Respiratory therapists. If you're on a ventilator or can't breathe properly, these are the oxygen ninjas. Pharmacists. ICU meds are intense. You need a pharmacist who can mix a cocktail stronger than your ex's excuses. Physiotherapists. Even in ICU, people need help moving, stretching, or breathing better. Together, they form the team that fights to keep you alive while the rest of us are still struggling to keep plants alive at home. Walk into an ICU and you'll hear a concert of beeps, buzzes, and alarms. Welcome to ICU, the EDM Festival of Healthcare. Here are the stars of the show. Ventilator. If your lungs can't breathe on their own, this machine becomes your lungs. Basically, your new life support boyfriend. Monitors. They track heart rate, oxygen levels, blood pressure, temperature, everything except your Netflix history. Infusion pumps. They deliver medication slowly and accurately because one wrong dose, and oops, you're meeting your ancestors. Dialysis machine. If your kidneys are on strike, this machine filters your blood like a Brita filter, but for survival. What kind of things happen in the ICU? A lot, and most of them are the kind that will make your non-medical friend faint. Intubation, putting a tube down the throat so a ventilator can breathe for you. Central lines and arterial lines, IVs for the pros. These go into major veins or arteries to give meds or monitor pressure. Sedation. Sometimes patients are kept unconscious to protect their brain or help with breathing. Blood transfusions, X-rays, CT scans, suctioning. It's like a science fiction movie, just with less CGI and more hand sanitizer. ICU isn't cheap. It's one of the most expensive parts of any hospital. Why? 1. You're paying for 24/7 monitoring. 2. High-tech machines. 3. Specialist staff. 4. Medications that sound like Harry Potter spells. 5. and an environment where even the pillows might have a sensor. But when your life is on the line, you want the best, even if it means your medical bill might give you a heart attack, which they can also treat in the ICU. Let's clear this up. Not everyone in ICU is in a coma. Coma, that's when your brain is not responding. Could be due to trauma, stroke, or medically induced. Sedation, doctors may keep someone asleep so the body can rest and heal. Life support, that means the machines are doing the work for your body, breathing, blood flow, nutrition, etc. It's like your body is on airplane mode while the ICU team is frantically trying to reboot your system. Yes, people do recover from ICU. Many walk out stronger, with stories to tell. But recovery can be slow after ICU. You might need physical therapy, emotional support, or just time. ICU survival is a victory, but it's not the finish line. There's something called post-ICU syndrome, fatigue, anxiety, even memory problems. So if your loved one seems different after ICU, they're not crazy, they've been through war. So next time someone says he's in ICU, know that it means he's getting the highest level of care possible. The ICU is not just about machines and tubes, it's about people fighting hard, experts working miracles, and families holding on to hope. Life is fragile. ICU reminds us of that, but it also reminds us that modern medicine is powerful. Human beings are resilient, and no beat is just a beat. It's a sign someone is still fighting. Thanks for watching. If you learned something new, or at least laughed once, hit that like button, subscribe, and share this with someone who thinks ICU stands for ACU. Until next time, remember to stay healthy, stay informed, and remember, everything serious can be explained in a nutshell.